As important as this topic of healthcare is, whenever it is mentioned, the conversation almost always centers on public health advocacy and saving lives. Rarely does anyone talk about the business infrastructures that make saving lives possible. Designing new drugs, creating breakthrough vaccines, or building distribution channels that ensures medications actually reaches the patients. To make matters worse, the welfare of healthcare workers is hardly ever discussed. Now, don't get me wrong, public health advocacy and saving lives are two most critical pillars in the healthcare sector. But the business of healthcare is equally as important because it is the backbone that holds all components together, and without it, even government-owned establishments will eventually fail. Here is the reality. A closer look shows that most of our healthcare workers are leaving the country not only because of a poor welfare, but also they want environments with standard medical procedures, cutting-edge facilities, enabling them practice effectively. The business of healthcare is taken seriously outside Nigeria, yet not every healthcare practitioner will own or run a business. If those who are equipped and passionate about the business side of healthcare continue to live, we will not only run out of jobs for the growing number of healthcare graduates annually, but even more dangerously, the ability to save lives will no longer be guaranteed. My name is Allen Abolodje, and my journey into business started back in 2008 as an apprentice in a wholesale drugstore. And for over 5 years, I studied and understood the wholesale business model in the Nigerian markets, drug distribution channels, and the role of patent medicine dealers in the health economy system. In 2013, I launched my first major business in wholesale rice distribution. As a young entrepreneur, I created marketing pipelines that saw to the movement of hundreds to thousands of bags of rice across the country. The business grew fast, but later collapsed due to custom restrictions, my lack of experience, and what I now call the Nigerian factor. In 2015, I worked alongside my mom in starting up a clinic, where I gained hands-on experience in management, administration, and the true demands in running a healthcare setup. Since 2022, I have been closely involved with community pharmacies, contributing to business development, administration, service delivery, and building an efficient job system. Today, I help pharmacies, medical labs, clinics, and other healthcare businesses create the domino effects that strengthens every aspect of their operations. I am currently undergoing training to become a licensed pharmacist, and I am deeply passionate about the business of healthcare and the welfare of its practitioners. So whether you are a medical student, a pharmacy student, a healthcare practitioner, or simply someone curious about practical strategies to grow healthcare businesses in Africa, hit that subscribe or follow button and join me on this journey. Let's build the business of saving lives.